Well, Matt Hancock was telling us earlier about the pressure on the NHS, and of course it's something that's been felt by those working on the front line, including paramedics and those people driving ambulances. Well, Tracy Nicholls is the Chief Executive of the College of Paramedics, and she joins us now. How much pressure is the ambulance service under?
It's under unprecedented pressure. Sophie, we're very used to seeing ambulance services take some strain over the winter months due to the normal pressures that you'd see any particular year. But this year particularly has seen incredible pressure because of the clinical presentation of the patients that our members are seeing. They are sicker, and we are seeing this incredible bottleneck, despite the Herculean efforts of both our paramedics and ambulance staff and the emergency department teams. We're seeing the ambulance handover delays at a scale we haven't seen before.
We've all seen, of course, those images of ambulances backed up outside hospitals, waiting to get the patients inside. How long are ambulances having to wait outside hospitals, and is that putting patient safety at risk?
So I think it's different across the country, and we've seen certainly in London and the South East an increased level of pressure recently. Our members have reported to us that they can wait as little as half an hour, but we've had some members who've waited 5, 6, 7, 8 and even 9 hours.
9 hours?
9 hours, and that's with a patient for their experience. We know that patient experience, if that's poor, that can affect clinical outcomes. But I would say, Sophie, the hidden risk is that your viewers can see the ambulances at the hospitals. That doesn't take into account the huge number of patients that are waiting for an ambulance that can't get to them. So the control room staff, who are also doing a fantastic job, are holding those calls until they can get a response.
So very true, the sort of hidden delays. How long are people having to wait for ambulances?
So for the immediate Category 1 calls, the life-threatening calls, there doesn't appear to be too many delays. For Category 2 calls, we have seen in those high-pressure areas around London and the South East, slight delays of maybe an additional 10 minutes. It's really those Category 3 and 4 calls. Those Category 3 calls would be things like abdominal pains or falls, and some of those patients in those high-pressure areas have waited up to 10 hours.
Up to 10 hours for an ambulance. And I guess, as you say, look, these are Category 3 and 4. It's not deemed to be life-threatening, but at the same time, people need ambulances for these things. That's the reason that they're calling them, right?
Absolutely, and we are cognizant of the fact that our members are working in an environment, particularly in this weather, where if someone falls outside, for example, the people in the call centre will try their absolute utmost to try and get a response to somebody. But it's really frightening when you're waiting for an ambulance, even if it arrives in minutes. It's a scary thing for a patient to wait for an ambulance.
It's worth talking as well, isn't it, that COVID is having an impact on people who don't have COVID as well, who have other health problems, who need ambulances. I'm thinking of anyone from, someone having a stroke to someone having a fall to someone even having a home birth, for example, and then needing potentially to go to hospital. Is there a risk that if the NHS continues to face the kind of pressure it's under now, cases are still rising, that you might not be able to get an ambulance that you need because of the pressure?
I think it is a potential risk, and we are open for business, as is all the NHS. The ambulance services are doing an amazing job under difficult circumstances, and we really want people who have those conditions to call. The stroke networks are still open, the heart attack centres are still open, the trauma networks are still open. We really do need people to understand that COVID doesn't preclude them from getting help and care. But I'm sure it's frightening for people to think that because of the pressures from COVID, that they may somehow not be able to get an ambulance in the same way.
When I was researching this interview, I read some reports, mainly from kind of local newspapers around London, saying that some people are having to be transported in police cars or even fire engines because they can't get the ambulances they need. Is that happening?
We know of rare occasions where that does, and certainly I know London Ambulance Service have engaged with London Fire Brigade and the Met Police to try and spread the load of paramedics and clinicians across the capital, so that the ambulances can get there, so people aren't conveyed in in a less safe environment, such as an ambulance. But that does bring with it its own risks. And I understand from our other emergency service colleagues that if you're waiting on scene with someone who you think is ill, you haven't been able to necessarily clinically assess them in the same way. You're going to do whatever you think is right.
Just finally, I mean, we've known for quite a long time that a winter peak of COVID-19 was likely to happen and bringing with it increased pressure. We know the NHS is always under increased pressure in winter anyway. And yet here we are, not enough staff, not enough beds, ambulances backed up against outside hospitals, sometimes up to 9 hours. What were the contingency plans drawn up? Were you involved in these contingency plans?
The college wasn't, but that's not necessarily a surprise. The ambulance services were, there are, it's part of the critical infrastructure of the country. So they absolutely were. But I think what wasn't anticipated, the new variant has ripped through the population, and you've got staff who are really trying hard to come in, even if they're not feeling great themselves. Not with COVID, if they test positive for COVID, they're doing the right thing. But they're frightened that they're going to introduce infection. They work predominantly in the communities, but certainly I think this has superseded all the plans that we could have had. But we do need to support the paramedic and ambulance workforce with good protection so that they protect the patients. That's what everybody wants to do. And we really need to work together to try and stem this bottleneck that's happening at the emergency departments.
Thank you. You've spoken really powerfully about the pressure that your staff and the ambulances are under, so we really appreciate you coming on. Thank you.
Thank you, Sophie.